What have you been hearing about hepatitis B? Is it a viral infection, a bacterial infection, or a fungal infection? What causes hepatitis B actually? Can herbal concoctions and other supplements do the magic of curing it for you? We are going to discuss hepatitis B today, get to know what causes it, how and when it occurs, how to live with it, and the treatment options available. This time with Nurse Joycelyn. Stay tuned. Hepatitis B is an infection of the liver that is caused by the hepatitis B virus. It can be acute or chronic. The hepatitis B virus can cause a chronic infection of the liver to the extent that it will put people at risk, at a high risk of death. That also results from liver cirrhosis and even liver cancer. Even though hepatitis B is a viral infection, you can get rid of it when you are exposed to infected bodily fluids. This is so because the acute form of the virus often goes away without treatment. But hepatitis B that is chronic is an incurable disease. You can't cure hepatitis B that is chronic. However, there are medications that can be given to you to manage the disease to a stage that it will render the virus inactive. Inactive hepatitis B means that you already have the virus, but since they are inactive, they can't spread. You can have hepatitis B without showing symptoms, and if you do, you may present with abdominal pains, fatigue, joint pains, fever, loss of appetite, nausea and vomiting, and general body weakness. You may also have symptoms of liver disease, such as dark-colored urine, clay-colored or light-colored stools, swelling resulting from fluid in the belly, in the arms, or in the legs. You may have yellowing of the skin or the white part of the eye, which is medically called jaundice. You can get hepatitis B when you are exposed to fluids from someone who has the virus. This can be amniotic fluids, semen, vaginal fluids, blood, and menstrual fluids. Exposure to infected bodily fluids can happen if you share needles and syringes with an infected person, if you have unprotected sex with someone who has the virus. Also, anyone can have hepatitis B, but your chances of getting it or your risk increases if you have a sexually transmitted infection like HIV, if you are receiving dialysis, if you take immunosuppressants, or have another type of liver disease. You may ask, how long are you contagious when you are infected with the hepatitis B virus? You are contagious as long as you have the hepatitis B virus in you. For example, acute hepatitis B lasts for up to 6 months, and you can spread the virus this entire time. With the chronic aspect of it, if you're having a chronic hepatitis B, it means that you are contagious for the rest of your life. Both acute and chronic hepatitis B can cause complications such as acute liver failure, chronic liver failure, cirrhosis, hepatitis D, that is another type of hepatitis that you can get if you have hepatitis B, liver cancer, and reactivated hepatitis B. This is acute hepatitis B that comes back if you take immunosuppressant or if you stop taking the medications. Immunosuppressants are medications that are taken to keep the immune system from attacking healthy tissues by mistake. Some of the tests that doctors do in order to diagnose hepatitis B include blood tests that will show if you have hepatitis B that is acute or chronic. Imaging tests like elastography that can detect if you have cirrhosis. They also do liver biopsy if they want more information about the liver than what imaging and blood tests can provide. Management and treatment include prophylactic treatment. Prophylactic treatment is when doctors give patients medications to prevent a certain disease. So you will be given a prophylactic treatment if you were exposed to the virus within the past 24 hours. The prophylactic medications include Hep B vaccination and then Hep B immune globulin. The immune globulin 1 contains antibodies that protect the body from viruses and bacteria. You can also be given acute hepatitis B treatment. Here, there is no specific treatment, but your doctor can prescribe IV fluids if you throw up a lot or if you have diarrhea in order to prevent dehydration. There's also chronic hepatitis B treatment. Here, the treatment will vary depending on the symptoms you are presenting with. And the options include surveillance. That means that your doctor is keeping an eye on your overall health. Antiviral medications may also be prescribed in order that they reduce the risk of you spreading it to others. And these medications are normally taken for life. Surgery may also be recommended if the hepatitis B has caused a cancer to remove part of the liver that was affected. And if the whole liver was removed, then there will be a need for liver transplants. How do we prevent hepatitis B? The best way to prevent an infection is through vaccination, and it takes 3 doses of the hepatitis B vaccine before you are completely protected. But in the meantime, things you can also do to reduce your risk include practicing safe sex, practicing safe needle use, and then avoiding the sharing of personal items. Symptoms of chronic hepatitis B can change over time, and one way of taking care of yourself if you are living with hepatitis B that is chronic is to stay connected with your nurses and doctors. You try to avoid alcohol as toxic substances build up in the liver. You eat well. You make sure you fill your plate with lean proteins, fruits and vegetables. And look for support, that is spending time with people who know what you are going through. And you take care before taking new medicines. This includes some herbal preparations and supplements. This brings us to the question if herbal concoctions can actually cure hepatitis B. While some herbal concoctions may claim to have benefit for liver health and immune function, there is limited scientific evidence to support their effectiveness in the management and treatment of hepatitis B. Potential risk involved in the use of these herbal supplements or concoctions include interactions with medications. Some of the herbal preparations may interact with the antivirals that you are given when you have hepatitis B. They can also cause liver damage. So if you have a liver disease or if you have hepatitis B, it is crucial that you consult with your doctor before taking any herbal preparation. This helps to ensure safe and effective management of the condition. This is how we end today's video. This time with Nurse Joycelyn. Kindly subscribe to this channel if you've not done so yet. Put on your notification icons to stay updated on future health content. I'll see you in my next video.